Nothing on the Bunnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bunnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Vertex Pharmaceutical. Here's your host, Laura Bunnell.
This is the fourth and last podcast in this series that we have done about cystic fibrosis patients in Egypt. We hope you were able to hear about all the amazing people living with and working on behalf of people with CF. Cystic fibrosis is a genetic disease that causes chronic and fatal lung infections and interferes with digestion and impacts every organ. The average life expectancy in the United States is 47 years old. In Egypt, it's younger than 12. They don't really know the average life expectancy yet because they don't have a registry to follow patients. They don't have all the necessary records. They oftentimes just contact patients or parents by phone with no CF records handy. They don't have basic medications in Egypt because the Ministry of Health hasn't even acknowledged that the disease exists. It wasn't until Dr. Nasr, a professor at the University of Michigan and director of the CF clinic and native to Egypt, began insisting in visits with doctors that CF did exist. But they didn't believe her until about 20 years ago. Dr. Nasr and her team were able to start testing patients with CF symptoms and now have diagnosed about 1,000 people with the disease. Joining us today is Dr. Samya Nasr and Dr. Eman Fouda. She is a professor of pediatrics at Ain Shams University in Egypt. I wanted to thank Dr. Fouda for joining us. She is a professor of pediatrics at Ain Shams University, and you're joining us from Cairo, Egypt. Is that correct?
Yes.
Well, thank you so much. It's such an honor and a pleasure to meet you via Zoom. First of all, Dr. Samya Nasr from the University of Michigan has told us about CF in Egypt, but I definitely am interested in your perspective as well. Tell me about when you first met Dr. Nasr and how you started helping the people in Egypt learn about cystic fibrosis.
Actually, meeting Professor Samya had changed all our ideas here about dealing with cystic fibrosis. Thank you, Professor Samya. Thanks to her, she helped us a lot. Previously, we don't know how to manage the case of cystic fibrosis in a systematic way. It's a rare disease after all. And we are low resource countries, so not all the medications for this type of disease is available. But nowadays, we have most of the diagnostic facilities to diagnose cystic fibrosis, and we are trying also to make group all the patients along all the tertiary hospitals in all the university hospitals to be grouped together, so as to give them multidisciplinary form of care. Because as you know, cystic fibrosis needs care of many doctors, pulmonologist, cardiologist, physiotherapy, nutrition, gastroenterology. So now we are arranging what's called as multidisciplinary team in dealing with such patients. And this is not only in Cairo, in Ain Shams University, but also in different universities and different tertiary hospitals all over Egypt. So now we have some statistics for those patients. Before, we don't have such an organized way in dealing with them. But nowadays, we have such a way. And we are in communication with all pediatric pulmonologists in Egypt about the update in managing those patients.
So, Dr. Eman Fouda, I don't think I said your first name in the beginning, but tell us how it's changed from long ago when you first started, and how many years ago was that, to the present day as far as diagnosing and helping people with cystic fibrosis.
Previously it was thought that CF is not present in Egypt before. The clinical picture of this type of disease as regard the pulmonary manifestations or GIT manifestations, sometimes it's not taken together. So the diagnosis of this case was not clear for most of the cases. To the extent that we have some families that they lost their children undiagnosed. They know the diagnosis later on when we start to diagnose their new children. But nowadays, we have such an organized way in dealing. We are discussing with all the junior doctors about the clinical picture of the disease. So if they have any suspicious case, they are going to refer to our hospital. If any patient have pulmonary manifestation or GIT manifestations or failure to thrive or whatever the dilemma of all clinical picture of cystic fibrosis, they are calling us and they are sending the cases. And in our hospital, we have such facilities so we can start the proper diagnosis up to gene studies. Then we have filing sessions and registration for those patients and starting their management and follow up by all the means of diagnosis we have.
And what would you say the biggest challenge is for you as a doctor trying to help the families with CF?
At first, actually, the most important thing for them is treatment. Most of the parents, through the Google and through the PubMed, they know that this disease prognosis is poor and they are going to lose their children sooner or later. So trying to change this attitude in their way of thinking, that no, we can help you, we can support you, we can minimize the complication, we can minimize their admission to the hospital, because most of those patients before admission more than once per month, and they stayed in the hospital for a long time, many types of antibiotics. But nowadays, we are trying to minimize their admission to the hospital. We are in always contact with them through the WhatsApp and through different types of communication. So as we can control their symptoms of acute exacerbation to the degree that they don't need to come to the hospital for admission. And also, we are maintaining their way of growth. Most of the chronic patients have stunted growth. But through our care of their GIT problem, through giving the enzyme replacement for them, we are trying to approach, of course, not the usual way of growth of children, but at least to be in a proper way, at least. And this is very important for the parents, actually.
Can I interject for a second? Eman, I think she also would need to know, that the limitation that we don't have medications in Egypt to treat CF.
And that's a great point by Dr. Nasr. Here we can get Pulmozyme and we can get albuterol.
In the past, we have some challenges as regards the diagnosis. Alhamdulillah, it is solved to a great extent. Now we are facing the big challenge, which is the medication. Of course, as you know, the curative medications which are available now in USA, it is not available in Egypt. So this is a great problem. In addition, also to the Dornase alpha or Pulmozyme, it is not available. So we are only depending upon alternative measures in giving nebulization for the patient. They are, of course, less effective than the original one. That's why we are hoping to find more and more support for those patients, actually, by facilitating the presence of such advanced type of medication here in Egypt.
And how do you get more advanced medication? How does that change come? Is it from donations and from what Dr. Nasr is doing and how she's helping you, or how does that change come?
Actually, Professor Nasr helped us a lot to have the machines for diagnosis, and she's always supporting us. But for medications, up till now, we are depending upon charity only and anyone to help us. But actually, still, we want this message to reach clearly to our MOH, to know that this disease is present and we need support. But again, the expense of the medication, especially the curative type, very, very high.
I think, too, I also relayed this thought to Dr. Nasr. So I have 2 daughters with cystic fibrosis. They're college age now. I'm so grateful for all the wonderful care that they've received. I can't imagine if I was raising them in Egypt, they would probably not be alive right now, correct? Is that true?
Of course, we have a great hope actually to have these medications in Egypt. We are trying to support the patient, but presence of these medication will changing actually their way of life. You are right. We can lose our patients if this medication is not available.
That's really hard. What do you see with your patients and your families, and what message do you have to other CF families here in the United States? I mean, our lives are night and day, correct?
I mean, before, our patients didn't know about the presence of curative medications. But through the social media nowadays, they know this. They know that the medication are available in USA or in any other country, and they know that children in other countries also have the chance to take this medication and to have better survival. And this is not available for them. And this will actually very painful for them because they know the medication is there, but they cannot afford to bring this medication for their children. Hoping that we can help them at any stage.
So what do you tell the parents, and are you still trying to make do with other things that simulate what we have in the United States?
Only all what I got here is only supportive measures. The inhaled antibiotics, which are available in Egypt, some form of physiotherapy to maintain the lungs in a better way. So as when these curative medications are present at any stage, they are in a good condition, so they can get benefit. The problem is that if their condition, if their pulmonary problems get worse and worse, they will reach into advanced stage or end stage respiratory problem. Even if these curative medications are available, maybe they will not get benefit from it. That's why we are trying to support them as much as we can by the available medications present now, hoping in the near future, this medication can be present in Egypt.
Can you give me the story of maybe one of your patients? You don't have to use their last names. You can even change their first names, but just so we get an idea of the average life of somebody with cystic fibrosis there. Like, do they have a clinic? Can they go? Are they emotionally okay? Do they want to move to the United States just for the medications and things like that?
You know, I have one patient, of course, he's not his real name, but his name is Ahmed. Okay, now he is 14 years old. Actually, I started my journey with him as a physician since he was 4 years old. He has a mutation Delta F508, and he has an advanced case of bronchiectasis. He has no chance actually to go to school. He is dyspneic, he's oxygen dependent, and his family is supporting as much as they can, but they are actually a very poor family, but they are trying to give him the best chance. Actually, in our hospital, we are supporting him a lot. We are giving the available medications. We are giving the nebulization. We are giving the physiotherapy sessions for him. But he is on the wheelchair right now. He cannot do any effort. He is miserable, actually, and I'm trying to support him emotionally. And we have some psychiatrists, some doctors who are dealing with him and dealing with his family, because his family also is suffering a lot, actually, due to his problem. And they are still having the hope that the medication will be available at a time. So they are just living on this hope.
And just so people understand, is it possible to say, would he be so much healthier if he had the medications that we are lucky to have here in the U.S.? Would he be doing better? Like, how would, I know it's hard to say, but would there be a difference?
Yes. The problem is that, you know, I have some patients all are which are teenagers. They are reading about that we have other children in USA or in other countries, which are now, due thanks to insurance or thanks to other measures, they are supported by this medication. And they know that their way of life changed a lot. They now can go to their school. They are not fully dependent on their parents. So they are coming even to my clinic with some photos or images about those children in other countries. They told that those children already took the medication and they are nearly normal right now. So, and they are asking me if they can have such a chance. I'm always supporting them, actually, and telling, just take these medications right now, preserve your lung as much as you can. So as these medications are going to come to Egypt sooner or later, so your lung should be in the better way, so as you can get maximum benefit from this medication. So they are just living on hope that this medication will be present at any time.
And obviously, you could practice here in the United States and work with CF patients. You could probably practice anywhere in the world that you wanted to. Is it challenging or frustrating, even though obviously you love being in your country? Is it frustrating to be there as a physician because you know that if you were maybe somewhere else, you would have better access to help your patients?
Of course, sometimes I am feeling frustrated, actually, but it gives me hope that I am trying to help them even with these low resources. You know, when I start working with those patients, I don't have diagnostic measures to diagnose the case. But alhamdulillah, now I have the ability to help diagnose. I have the sweat chloride testing now. Before, I don't have the facility to do gene study, but now there are some centers in Egypt, they can do some gene studies. Of course, not all the mutations, but at least some of the mutations. Before, I don't have a hope to have their pancreatic enzyme replacement, but nowadays, thanks to the charity, actually, I can help them by these enzymes. So every year, I feel that I can help my patients more. I can give him better chances of life, even with such low resources.
And then I don't know how insurance works there. Do you have a system where everything is covered, or is it not covered like the US, just private insurance? Or
Actually, our MOH are now working in order to have this insurance covering everyone. Still, we are in the beginning. We have some governments in Egypt now are fully covered, but still, it's a slow process. It will take time to be for the whole public. But hoping that it is very soon to be available. But even these medications are actually very expensive, and it is for life, as you of course know. So I'm not so sure whether the insurance, even in the near future, can cover all these patients and all the time. I'm not so sure still.
Do you talk to any CF patients here, or just kind of bridging the gap between the two communities?
You mean for me to speak to the patients, or our Egyptian patient to speak to patients in USA?
Yeah, maybe that's even a question for Dr. Nasr. Maybe I don't think anybody our US patients haven't talked to anybody in Egypt, right? We haven't done any of that. Okay. Yeah, it would be interesting. Give them perspective,
It would give them perspective, but at the same time, there is no hope in getting what we have here in there. So I'm worried that it will make the people in Egypt more depressed about their disease. So that's kind of a double-edged sword here.
That's true.
But it is a good idea, especially for teenage kids. If they wanted to communicate, that would not be a bad idea.
Dr. Fouda, what are your hopes for the future? What do you want to see come to your CF community there?
My dream is that the Egyptian children with CF, they should have their chance as others in other countries to have all the available recent medications, especially the curative form of medications, actually. This will be a great achievement if we can help them. The cost is very high. When I am telling the parents about the cost per month or per year, they know that this is impossible. This is impossible for them. So my hope that these medications to be available. I don't know how. Actually, I don't know how. We are now communicating our MOH and just to let her know that we need to help those patients actually. But still, I didn't get encouraging reply. This is our Ministry of Health.
And the Ministry of Health is in charge of your health insurance or your health care?
Actually, we are trying to give them the idea about the actual burden of the disease, and that is fatal disease if it is not managed in the proper way by the proper medications, actually. But in our country, we are 100 million, and I think maybe it's not in the very soon future that our Ministry of Health can support all these patients.
So if I can add, the Ministry of Health doesn't really acknowledge cystic fibrosis as a disease that's present in Egypt yet. So what we're hoping is that by having the diagnostic equipments, which now they have, so Cairo University has one for several years, but now 4 other universities are having their equipment, including Ain Shams. And then once we have more diagnosis, then we can go to the Ministry of Health and say, here, this is how many CF patients we have, because the Ministry of Health is really important in getting the drugs in the country. So they have to approve medications to come to the country in an official way, not like, behind the scene kind of thing. And then also help with insurance. So both insurance, but also the availability of the enzymes and the availability of the hypertonic, the availability of pulmozyme, all of these depend on the Ministry of Health. It has to be approved through them. So they've been now talking to the Ministry of Health, but it doesn't matter. I mean, they don't think that CF is really that many in Egypt. But if we show them the statistics, then they will acknowledge it, then things will get better. So I'm hoping in the next couple of years, we'll be able to do that once we have now more diagnostic ability all across Egypt.
And you said was it 12 when you started testing in 2007, and then there's 1,000 now, or?
Right. The 2007 Cairo University start having they had their machine. And then I think, Eman, you had your machine around 2010 or something like that?
Yes, 2011. Actually, right. We have our machine.
And their machine wasn't really the one I would want them to get. So now they got the good one that, can give you good data. So once we start, I mean, it's still early, even though it's been 10 years or 9 years for Eman's institution, it's still not enough time. So we need to organize, and also the rest of the country was not having the ability to test for the disease. So right now, through the lectures, through the talks about cystic fibrosis, there is a lot of awareness in the country. And also we're hoping that we'll be able to get the numbers to go to the Ministry of Health in the next couple of years.
So once you get trained on those machines, Dr. Fouda, how many people do you think you'll be able to diagnose?
Actually, now we are giving more and more lecture for our junior doctors in all governments of Egypt. Actually, we are teaching them how to suspect cystic fibrosis. And now I can tell you that every 3 or 4 days, I am getting one suspicious case referred from the junior doctors if they have such manifestation. So now I have in my center more than 200 cases. They are already diagnosed totally. This is only in Ain Shams University. But we have Cairo University, Asyut University, Alexandria, all have more or less the same number. This is the well-diagnosed cases, and I'm expecting more and more with using such recent diagnostic utility which had reached Egypt recently.
And is there anything else that I didn't ask you that you want to talk about in, regard to the challenges there with cystic fibrosis, or any of your hopes or anything that you want to mention?
Actually, you asked me all the questions about cystic fibrosis, but we need too much support for those patients from all aspects, not only medically, but psychologically and economically. They need support, actually. Hoping that very soon we can give them better and better chances for life.
And does that support, do you still think a huge part of it comes from charity, comes from the work that not only Dr. Nasr, but all other people as well are bringing? Is that kind of where you are at this point?
We are fully dependent upon charity right now. And some of the leaders in our teaching hospitals also, they are believing in the care it should be given to those patients. So I'm expecting more and more support for the coming years, but it needs some hard work from the pulmonologist actually to make all others believe that this disease is present in Egypt and those patients are actually miserable and they need more and more help, especially that their line of management is already available.
Thank you. And go ahead, Dr. Nasr.
The thing that happened in the last 2 years, and that's how the equipment, the sweat testing equipment came to Egypt, was a collaboration with an organization called MICFA, or Middle East CF Association. Is funded by the foundation, the CF Foundation as well. So we're able to get the equipment, 4 of the equipments to 4 university centers just recently. So I think Eman didn't even have hers yet. We're dying. It's stuck in the airport. But yeah.
Most of the paper, alhamdulillah, finished today. Okay. And we are expecting to receive ours within 5 or 6 days. I'm going to have a photo and send it to you.
Yeah, please do.
Yes, I want that photo. Send it to me.
Yes, I will send the photo, yes.
Through this organization, I'm actually going to be collaborating with all the Egyptians. I mean, without the organization, I was going to collaborate anyway, but now it's officially through the Cystic Fibrosis Foundation and the MICFA, the Middle East CF Association, to help them establish, like a care plan for the patients that be unified, like a CF center approach that they don't have right now. They have pieces of it, but they don't have the whole thing.
Yes.
So we're hoping that in the next 5 years, CF will be better managed in Egypt. But again, the resources, I mean, the country is poor and we don't have the medication. So I don't know how that will be solved, but we'll keep working on it. But for now, really, the donations are the thing that we keep the patients alive there with. This organization, the one I'm working with, also with the Turkish group, as I mentioned to you before, to improve. They have a center, but they didn't have everything in the center, and they needed quality improvement work. So in Egypt, we're a lot lower than in Turkey in the level of care for CF patients. We need to diagnose and to start working on that.
It's lower than Turkey?
The level of care is lower than Turkey, but the incidence of the disease is probably higher. Because Egypt, we had a lot of different nationalities coming into Egypt and staying in. So we have a lot of Europeans and a lot of other nationalities there that made the disease more common than in Turkey.
And then obviously tell me if I'm incorrect, but when I think of Egypt and having never been there, I really think of like this forward, big, rich country. So I'm wrong? Is that like it's hard to believe, I guess, that it's so difficult. I believe it, obviously, but I'm just saying it's crazy, right? That it's so far behind in CF.
Well, it's far behind in CF because the disease was never acknowledged as it existed. So we started working on that, several years ago, and finally now that everybody is aware, we're starting from really the beginning, first give me the equipment to diagnose the disease, and then take it from there. But in Turkey, it was acknowledged before. They have centers. Their Ministry of Health is supportive. They have the medication, except the modulator. They don't have that. So it's where you are in the world. But in Egypt, there's a lot of rich people. It's a very open country. We have very much like when I go, yes, I'm wearing my hijab, but I do whatever I need to do. I walk around by myself. So things like that are very. So when you go to Egypt, you will not feel like you're in a backward country or something like that. You'll be comfortable, but at the same time, the resources are limited, and there is a lot of poor people that cannot afford treatment, especially when it's very expensive. The hospitalization are covered. So when Eman admits patients, they are not paying a bill for that.
They are not paying anything. They are fully supported.
Right. But outpatient, and then the hospital has to have the medication as well. So Eman is able to get some of the enzymes through people traveling and things like that. But, Abbott might give them some enzymes, but otherwise very limited.
Can you talk about CF in the pandemic there, Dr. Fouda?
Yes, actually, when this COVID-19 pandemic started, we are too much worried about our CF patients to the extent that, we have a group patient registry for all our patients. We communicated with them because most of the parents are afraid at the beginning of this pandemic. We tried as much as we can to avoid hospitalization, to coming to the hospital. We send even their medications to their home by different means, actually, so as not to come to the hospital or not to be exposed to the infection. And we told them about the warning signs, which make them our symptoms, to make them suggest that their children caught the infection. And I'll make most of my junior doctors communicate with them regularly, so as to be sure that they are healthy, they don't have any symptoms, and we give them a stock of medications to be enough for them for 2 months, so as not to come to the hospital taking their medication.
So here's my last question, because we could go on forever, but it's a big question. And I've talked to Dr. Nasr about this before, but why can't we get there as a world where everyone is diagnosing CF at the same time? Like, what do we need to do to make sure, regardless of the country, that everybody knows about cystic fibrosis and we can get it tested everywhere?
Professor Samya.
That's a great question. And I think the CF Foundation is actually, I want to say in the last couple of years, have been interested in global cystic fibrosis. So not only that taking care of CF patients in the country is enough, they've been very helpful to the European CF Foundation over the years. But the new trend for the CF Foundation is really global. So they are interested in supporting some organization like MICFA, like I mentioned. They are interested in, working with other organizations. They've done work in India. They supported a group of physicians from Ohio State to go to India, where they did some diagnostics as well and tried to do some care there. So the hope is that CF Foundation, which is very organized, that would help us get through to low-income countries and get the CF. Because really the goal is to get CF patients, like you said, treated as the same or equivalent in all the world, not only in the US.
Wonderful. Anything, Dr. Fouda, you want to add?
Thank you for this meeting. Hoping that the next meeting will have good news about availability of more medications in Egypt, more better future of our CF patients, Egyptian CF patients. And thank you for this meeting, actually. I enjoyed.
What a wonderful time we did have talking. Such selfless doctors, Dr. Eman Fouda and Dr. Samya Nasr. Thank you so much. So much progress is being made slowly, but it is happening. And if you want to help with a donation to the CF population in Egypt, please contact the Bonnell Foundation and we will connect you. Our hope is that you were able to learn a lot about the challenges that CF families are facing in Egypt. Our hope is that you learned a lot about the challenges that CF families are facing in Egypt, and we hope that all of us can be the change and help people to live longer lives with CF in Egypt. The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know what's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, check them out online at thebonnellfoundation.org. That's BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, the science of possibility, and produced by Jag and Detroit Podcasts,